Next up in the hot seat, Doug Bowes, President and CEO of United Healthcare Community and State. Sir, thank you for coming. There are 5 managed care organizations that handle Medicaid in Washington State. In 2014, a couple of big pieces of legislation passed, 2572, House Bill 2572, and I think the Senate bill was 6312, that integrated behavioral health care in Washington State. Everybody has to move to that model in all parts of the state by 2020. United Healthcare is now engaged in moving down that pathway. What have you learned as CEO of a Medicaid plan and somebody with a behavioral health background? What have you learned about that integration in Washington State? What should we all know about how well it's going or is about to be going?
Well, the first thing I'd say is we still have probably a long way to go. We're spending a lot of time over this last year, and we will over the next year, looking at the collaboration capability of the system in total. We still have probably 60-70% of our behavioral providers that are way to the left side stuck in fee-for-service, and maybe 10% where we truly have integration and full collaboration. So that's the work that we have, and I think that's going to take probably another 2 or 3 years to get done. We've hired transformation experts to go out and work with practices, work with groups. We're doing it through value-based contracting. We're doing it through education. We've done a lot of pre-education before we've gone live in January. But I think we still have quite a ways to go, and it's not just here. I think this is true throughout the country. I think the good news is, though, that, and I have been in this for a really long time. I've been doing this since I hate to say it, the late 80s. But over that course of time, the carve-out behavioral health has gotten smaller and smaller. And across United in the Medicaid area, we just keep seeing it gets more and more integration is taking place.
I recall that at the federal level, the Mental Health Parity Act, I believe, passed in 2005. The state version of the mental health parity passed in 2006. Why are we still trying to figure out a way for the system to treat mental health equally as physical health?
To treat it how?
To treat mental health equal to physical health, both in terms of process and administration. Why are we still talking about making this an equal partner in the healthcare system?
But I don't know that the issue is that it's not equal, because it is equal. I was actually really amazed when that passed, that the following year we didn't see outpatient go completely through the roof. You would think that would have changed that way. We did not see outpatient increase dramatically from 2006 on. I don't think the issue is there's not parity. I think the issue more is that there's just not enough resource. We have a huge workforce issue for mental health. Yesterday, I was doing a presentation. I was saying that a board-certified child and adolescent psychiatrist is really like a unicorn. I mean, we don't have them. There's just not enough of them. As it turns out, there were 2 in the room. So maybe not so much a unicorn, but it is. I mean, we just don't have enough resources, and I think Washington is really suffering from that. So I applaud the governor's effort to move things towards the community to try to fund this and move that forward. We do need more mental health here in Washington.
You may have seen this week there was an announcement that because Governor Inslee is promoting a public option package for a public option legislative package for this session with Representative Cody, others doing the legwork in the session on that. What do you think as a managed care plan president? It's not on the individual exchange, but United as organizations across a number of lines of business. What do you think about a public option, recognizing that there are a lot of details left to be decided and negotiated?
Yeah. I guess it depends on how it plays out and what the details are. I think there's a place for United Healthcare in that option. Somebody's got to manage it. Even you can have a public option, it still needs to be managed. So we're supportive of as many people being covered in the country as can possibly be covered. I believe in Washington now we have about a 5% of the population not covered, which isn't a huge amount. If that option helps cover that 5%, and we have some place in that, I think it would be great.
So I won't ask you to speak on behalf of the largest healthcare organization in the world, United, but if you want to, one policy bill that comes up often, Representative Harris is working on a bill that will increase Medicaid rates to Medicare in Washington state. The flip side of that is the public option proposal says that in the individual market on the exchange, those rates will come down from commercial rates to Medicare rates over time. Do you think that the healthcare system, that providers can live in a world where all of the reimbursement is blended to a Medicare threshold?
That's a good question. One of the things that we see on the Medicaid side is providers will tell us once we get past a certain percentage, 15, 20% of our patients are Medicaid, we're basically out of business.
Yeah.
We can't afford to keep going. And obviously, Medicaid is the lowest, Medicare is in the middle, commercial really bears the brunt. I think there's probably enough money there, but I don't think that the providers will be willing to do it. I think it's going to be a very tough sell to the provider community. But if that's what it is, I think people will sign up.
Yeah.
And I would love, managing Medicaid here in the state, and I would love to see those rates improve. I think it's a huge issue for our population that those rates are so low. It's hard to get people to take those numbers at times.
So let me make a few points here. I will just make them as declaratory statements, and you can tell me where I'm wrong. A, there is no sustainability plan at all for accountable communities of health. B, the waiver is going to end in 2021, and there's no model for funding accountable communities of health after that waiver expires. And C, I don't think there's a lot of interest amongst some in the administration to come up with a few $1 billion to fund all of that work beyond 2021. So, therefore, Washington State should act as if the accountable communities of care are a time-limited enterprise. Debate.
Gee, thanks. Really appreciate that question.
Thanks for being a sponsor.
No, I actually think the ACHs are in different places. And I do think some of them are in a place of saying, when it runs out, it runs out. But I do think they're all looking at sustainability plans, and I think that's certainly possible through a community resiliency fund, for instance, that gets established via the ACH and folks in the community, or if you have perhaps in King County, King County has plenty of capability to keep that ACH running. I think if and when they prove their value, I think then the community will chip in and they'll help pay for it. Last night someone was asking me, well, will the health plans pay for it? I don't know that we have the capability of paying for it. I don't know that we have the revenue to pay for it.
Yeah. Give us a big, bold prediction for the future of healthcare in Washington State in 5 years' time, when we're here back on the stage in 5 years and you're governor. What will we be talking about?
Well, I'm a little bit excited about one thing, digital healthcare. I'm very excited about what we're doing in that space, and we are bringing that to places all over the country through a variety of pieces. So, I'm sure a lot of people have a Fitbit out there. We're using wearables. We've got another project where we're doing, real-time glucose testing.
Yeah.
We've got a diabetic virtual counseling program. We have 100,000 people in that program, and those 100,000 people over the last 2 years have lost 1 million pounds.
Wow.
So things along those lines. In our tracker program, we're looking at steps. We have that group has walked, and this number astounds me. They have walked 200 billion steps in the program. 200 billion. And we are actually seeing results from this. But the next piece of that is, I think, going to be an individual health record, and we are pushing that out this year, and that will combine all of this information coming from the member with the claims information we have, and also information from the provider into one portable health record available both to the member and the provider.
Great. Doug Bose, President and CEO of United Healthcare Community State. Thanks, sir, for joining us on stage.